Hospitals in Colorado were caught in the crosshairs of a massive cybersecurity attack. The fallout is far from over after a security breach at Change Healthcare, which is part of the United Health Group.
Yeah, some local hospitals are seeing cash flow drop off by millions. 90's reporter Anusha Roy joins us now. Anusha, a big question is how this is all impacting the care they give.
Yeah, Jordan, Corey, one of the hospital systems I talked to said that they are essentially giving care right now for free, right? They're not going to stop their surgeries and their appointments and their care, but they also know that they are a long way off from things going back to normal. I had a pretty telling conversation with Community Hospital in Grand Junction. It's a smaller hospital, less financial runway, that was relying on Change Healthcare for everything from processing claims to even credit card payments and online payments. Now, Change Healthcare is a subsidiary of United Health Group, and the CEO of this hospital said they have been in the middle of this mess since the end of February, going on a month. They have not been able to send out a bill in that entire time. So they went from bringing $21 million a month down to $10 million. So now what they're doing is they are pushing off their mortgage payments for 2 months. They're dipping into their reserves. They're extending out payments for other bills just to make sure that they can make payroll and keep their hospital open. They know all of this is temporary, but they also don't know how long it's truly going to last.
The team has done a great job of working day and night trying to get bills out. We had volunteers in sending out paper bills, stuffing envelopes, doing what we could. But it's just been a real challenge. The communication with Change Healthcare has been very sporadic and extremely disappointing. They've just not been very forthcoming with what's happened, what their plans are.
Now, the big question that they still don't have an answer to is what happened to their patient data. They have no idea a month into this. And when you hear people talking about this being the largest cyber attack on the U.S. healthcare system, you look at numbers from the American Medical Association that surveyed around 1,000 hospitals. 94% are saying that they are dealing with financial impacts of this. 74% saying that they are dealing with impacts on patient care. Here in Colorado, the State Division of Insurance did say that they've opened their door up to the Colorado Hospital Association, telling members to tell them if they're dealing with really big issues so that they can escalate things with United Health Group. They're also asking insurance companies to be very forthcoming and report any kind of issues with services and payments and do what they need to do to make sure that they're not disrupting care for patients here in Colorado. Meanwhile, Corey and Jordan, United Health Group said that the pharmacy services are mostly back online. That is a very big deal. They're working on electronic payments, and as of Monday, they just started processing the medical claims again. So there's a ways to go before things are back to normal.
Yeah, a nightmare come to life for so many of these patients out there. All right, Anusha, we appreciate your reporting.